What about pain in the left upper side of your tummy? Let's start just by thinking about the different types of organs that could be there. So you've got the spleen, the stomach, and the bowels. The spleen is not really a common cause of pain and bloating and nausea. It can cause issues, usually if you've had like a really bad abdominal trauma, which can potentially cause the spleen to rupture. That is a situation that might be more likely to happen if you have like glandular fever. But problems with the spleen, usually we can pick up some of it on the blood. And if we feel your tummy, I mean, we can only really feel the spleen if it's more than 3 times bigger than it should be. But let's talk about the stomach and the bowels. So with the stomach, there could be gastritis or esophagitis or some sort of heartburn or reflux, which is causing the stomach acid to come up up into your esophagus. Or you might just have excessive acid production, which is causing like a small erosion in your stomach, and that can lead to pain, it can lead to nausea, it can lead to bloating. And if you're constipated, like your large bowel kind of goes across your tummy and goes down through your sigmoid colon and then comes out your poo pipe, and that can cause pain, bloating, really constipation. It can make you feel nauseated, because if you imagine that your bowels are a pipe and you've got really hard poo rocks inside it, when your bowel's trying to squeeze it and move it along, it won't really move as freely as it should do, and that can cause pain because there isn't much space around the poo. Gas can build up and that can make you bloated, and if things aren't moving as quickly as they should be, that can also then make you nauseated and make you want to vomit, because there's just not really enough space for your poop and food to move into. There are obviously lots of other reasons that you can get pain in that area. In really unlucky people, it could be a sign of an inferior heart attack, but that would usually be associated with other symptoms. And there are also things, there are also various cancers that can cause some of those symptoms. It's really non-specific. The common things are common, but detailed history, examination, possibly some investigations can help us narrow down exactly what's going on.